The number of clients that I've seen with knee osteoarthritis in the last 5+ years has skyrocketed. And the majority of these clients all share one common feeling, and that's confusion. Confusion about what they ultimately need to do to reduce their pain and get back to movement. And this is not surprising considering all the information that is across the internet, all the different injection therapies that people recommend that you need to get, all the different exercises that people recommend that are the magic fix for your knee pain or to regrow your cartilage, or all the different dietary changes that you need to be making. And the problem that I see here is that because there's never really any clarity in what you're ultimately trying to do there to improve your knee function and pain, you never end up really sticking with anything long term. You do a little bit here, a little bit there, but because there's no real clear pathway, you don't stick with it long term. And so the way that I work with clients here is by simplifying the processes that you need to ultimately work through. And the way we do that is by understanding that everything we do to improve knee joint pain and function falls within two main categories. Number one is cleaning up the internal environment within the knee joint. Okay, now the knee joint is the biggest joint in the whole body, and in the presence of osteoarthritis, you may have some swelling, you may have some irritation inside the knee joint. So strategic use of compression, heat, ice, gentle movements, modifying your activities day to day all help to improve that internal environment. That is very different to category number two, which involves beginning to shift stress away from the joint into the muscles around the leg. If you try to focus on that too soon, you're just going to flare up your knee. You're going to irritate the knee. But the way that you shift stress away from the joint in a way that respects the loss of cartilage is very different to strengthening muscles in a knee that doesn't have osteoarthritis, okay? So we have to be mindful, we have to be thoughtful about the way that we are shifting stress away from the joint into the muscles. So those are your two categories. Number one, you're trying to improve the internal environment inside the knee joint. Number two, you're trying to shift stress away from the joint surfaces and into the muscles around the whole leg, not just the knee, but the whole leg, okay? Of course, there is overlap between those two different categories, but they will give you clarity in actually improving knee joint pain and improving function over the long term.